IH is an 80-year-old single female who has no apparent occupation. The emergency medical services team found the patient lying on the floor alone in her townhome in squalor. She has Alzheimer's dementia but currently denies any complaints. Her past medical history was unable to be obtained reliably because of her mental status, but she did report that her nephew checks on her. She currently has a UTI. She, like I said, also has Alzheimer's. She currently also has hypertension, and that was available to be revealed through her home medications. She also has tobacco dependence and wears a nicotine patch, and she's on a regular diet. From her nephew, some information was able to be obtained that she lives alone in a townhome. She's on a low income, and that her nephew does provide care 1 to 2 hours per day. She's partially independent, and she has a rolling and standard walker. She does not have a guardian or home health agency, and family and friends do provide transport for her. She did report that she had a home health care agency for a short time after she was at Baptist Health, but she could not remember the name of that healthcare agency. A current medication she is on is Zenoxaprine or Lovenox, which is a sub-Q injection given 40 milligrams once per day. Its class is that it's a low molecular weight heparin, and its mechanism of action is it inactivates thrombin and factor XA to suppress fibrin formation, and its effect on the patient is that it is effective in preventing her blood clots, and she doesn't have any apparent side effects. It's indicated by her hypertension and to prevent those blood clots associated with it. Adverse reactions include bleeding, agranulocytosis, and aplastic anemia. Important teachings would be for the patient and even equally as important, if not more, are definitely for the importance of patient safety. And if she were to have any cuts or bruises, she could bleed out very quickly. And because of her Alzheimer's dementia, she could forget about a cut and it could worsen very quickly, or not notice signs and symptoms of a clot, or if anything was wrong with her, and that condition could worsen very quickly. She should also have a PT test done and monitor her INR. And some nursing interventions or teachings or assessments that should be done are to assess her current safety and her care, along with the effectiveness of her nephew taking care of her, and if she would require a home health agency, to administer medications to prevent blood clots, and also medications that could help treat the symptoms of her Alzheimer's, to monitor her level of consciousness and orientation, not only when taking medications, but also in the hospital and at home in general. And just again about the patient's safety, she could forget about a sign or a symptom of an existing infection or clot or anything that could be wrong with her. So it's important to have a strong caregiver or strong home health care agency.